eyes?
Nope.
Okay, great. Next, I'm just gonna take a look at your ears. Just gonna inspect them. You're not having any pain or any discharge, any trouble hearing, no muffled, nothing like that?
Nope.
Okay, let's look at this one. Okay. So what we're going to do for this is I'm going to actually first occlude the left ear, and I'm going to say a phrase. I want you to read that phrase. Say that phrase back to me, okay?
1, 2, 3, 4, 5, 6.
Great. And we're going to do the same thing on the other side, okay?
6, 5, 4, 3, 2, 1.
Good job. So now I'm going to take this tuning fork. I'm going to place it on the top of your head, and I just want you to tell me if you can hear it in the left and right, or both, okay? So when I start the exam, I'm just going to take a look at your head. Just going to examine that. You haven't noticed any bumps, any lumps, any drainage of any types, like from welts, nothing like that? No itching?
Nope.
Okay, great. Then I'm just going to touch right here. Okay. I'm going to apply some pressure here, and I just want you to tell me if you have any tenderness.
Nope.
What about here?
Nope.
Great. I'm going to put a little bit of pressure here. I just want you to clench your jaw. Good. I'm going to touch you, and I just want you to tell me if it feels the same on both sides. The same? The same? Great. Okay. Looks nice and clear. You can visually see it, the membrane. Let me change the cap. So now I'm just going to feel around your eyes, okay? Touch your lacrimal ducts. I'm just going to look in your upper and lower lids. You haven't noticed any drainage, any discharge of any kind, have you? No pressure, no pain like that?
Nope.
Okay. Listen right here. On the other side as well. Okay. So next I'm going to take a look at your nose, okay? I'm just looking at the structure. I'm going to have any tenderness around there. Okay. Say ah and stick your tongue out.
Ah.
Perfect. I'm going to take a look into your tonsils. You can stop saying that, it's okay. Just keep your mouth nice and open. Lift your mouth up, tongue, into the side. Great. I'm just going to take a look at your teeth. You haven't noticed any pain or ulcers or any drainage of any type, have you? Great. Move your tongue side to side. Okay, and push it to the roof of your mouth and to the bottom. Perfect. Good. So for the next part, I'm going to take a look at your neck, okay? Just going to take a look here. Okay. I'm going to apply some pressure on the left side. Apply some pressure on the right. I'm just going to palpate the lymph nodes that are in your neck, the cement, okay? Supraclavicle. Okay, and if you can actually turn around for me to the other side, what I'm going to do here is just palpate the posterior thyroid. You haven't noticed any swelling of your throat, have you? Okay. Okay. You haven't noticed any pain or anything like that? Okay. So what I'm going to have you do for this part of the exam is I'm just going to have you say 99, 99, 99 over and over until I tell you to stop, okay?
99. 99. 99.
Okay, you can relax. Perfect. So I'm going to apply some pressure, okay? Nope. I'm just going to lay you down. Right here. I'm just going to look at your neck. Okay, great.
All you need? This.
So we're going to do it passively and then actively. So I'm just going to move your head and then just let me know if it hurts or if you feel any tenderness. Okay, now to the side, this side, now turn it. Okay, all right, so now do that yourself. I am checking for your trachea, and it's their midline where it's supposed to be. It's smooth and firm. Here's some water. Go ahead and open it, and I'm going to tell you to take a sip and swallow in a little bit. I'm going to check your thyroid gland. Okay, it's palpable, but it's not enlarged. I don't feel any nodules or any masses. Okay, go ahead and take a sip of water and swallow. Okay, and the cartilage moves appropriately when you swallow. Now, if it was enlarged, I would...
Okay, now I'm going to do your lymph nodes. Alright, preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical. Can you tilt your head for me? Deep cervical, posterior cervical, and go ahead and lean forward, supraclavicular, and then I'm going to do your tempo, a +1, and then go ahead, cranial nerve 5 is intact. And I'm going to feel your frontal and maxillary sinuses when I'm up here. Any tenderness?
No.
Okay, and was there any tenderness with your nose when I palpated it?
No.
Okay, perfect. And I'm going to go to cranial. I am going to check your hair now. Your hair is fine, clean, black, right for ethnicity. Let me know if there's any tenderness.
Okay.
Any tenderness?
No.
Okay, perfect. I don't feel any lumps, or I don't see any lesions, no abnormalities.
Okay, so now we're going to continue with the abdominal assessment with our advanced techniques. I'm going to begin by having you lay a little bit on your left side for me. Okay, this is a test for appendicitis. I want you to kind of swing your right leg back. Does that hurt?
No.
Okay, alright. You can go ahead and lay back on your back. So the psoas sign is negative. Next, I'm going to go ahead and look for McBurney's point. So I'm just going to pull your shorts down just a little bit more, okay? So that I can find the anterior superior iliac spine. And then I'm going to go about 2/3 from the umbilicus down to McBurney's point right here. I'm going to take 2 fingers and I'm going to press, and I want you to tell me if this hurts, okay? Okay, so there's a negative McBurney sign. That's a good sign that there's no appendicitis. Now I'm going to come over to the other side. For Robsing's, I'm going to press right here, and I want you to let me know if it hurts on the opposite side, okay? Alright, good. And then we're going to do another test, is the obturator sign. So I'm going to have you flex your right leg to 90 degrees and internally rotate your thigh. Did that hurt? No. Alright, good. So then I'm going to also assess for cutaneous hyperesthesia. I've got my sharp tool here. I'm going to go ahead and let you feel it. Okay? So I'm going to just do a light little tap right here. Tell me if anything hurts. Alright, good. And then for rebound tenderness, I'm just going to press in, and I want you to let me know if it hurts when I come back out, okay? Watching his face for any pain. Alright. Alright, so that's a negative rebound tenderness. So then I'm going to look for the gallbladder here. I'm going to go a little bit medial on the right side, and I'm going to press in for Murphy's sign, and I'm going to press right back out.
Alright, next thing I have to do is I'm going to ask you to open up your jaw, and then I'm going to push up and you try and resist. Alright, close your jaw, and I'm going to push down and you're going to try and resist. Okay, and then now you're going to move your jaw to the left and to the right for me. Okay, and you're going to hold your jaw, and I'm going to push to the side and with your jaw closed and try and resist. Alright. Now I'm going to ask you to clench your jaw as hard as you can, and I'm going to feel for any kind of abnormalities. Alright, you're good. Close your eyes. Go ahead and stick your tongue out.
Salty.
Alright.
Sweet.
Okay, good.
And the masseter muscle. Clench. And one more time. Good. Now I'm going to have you close your eyes and let me know if this object is sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Sharp.
Good. You can open your eyes. Now in cranial nerve number 7, the facial nerve. Can I have you close your eyes? Open your eyes. Raise your eyebrows. Smile. Frown. Puff out your cheeks. Good. Cranial nerve number 8, the acoustic nerve. Can I just have you stand up for 1 second?
Sure.
So I'm able to get the 3 letters or numbers.
EM2. KL3.
Good. If you can sit back down for me. Motion. Good. All right, muscle strength. Can you hold your arms up like this? Pull towards you. Good. Push out towards me. Good. Now make a fist and hold your arms out. Push up. Push down. Good. Now if I can have you spread your fingers and don't let me close them. Good job. And squeeze my 2 fingers. Good. Now if I can have you lay back for me. Good. I feel slight pressure on the palm of my hand when I check the Achilles tendon. Now I'm just going to test the Babinski reflex. Good. And that was a normal response with the curling in and down of the toes. So Babinski reflex is negative.
Sharp. Dull. Sharp. Sharp.
Good. Open your eyes. Now I'm going to...
1. 2.
Good. Other hand.
1. 2.
Good.
Now keep your eyes closed. Can you tell me what this object is? You're allowed to feel it.
This is a paper clip.
Okay. Now hold out both of your palms. Are you able to tell me what this number is?
It's a 3,
And this number.
1.
Good. Now open your eyes for 1 second. The last thing I'm going to have you do is tell me if